Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a first-time guest. Let's all welcome Miss Jennifer Hilaga. Welcome, Jen. Yan. Jen originally Iloilo, right? Yeah. And actually, we're same age, Golden Girls, right? And I was telling her, she looks so young. Okay, now she moved to near us, Quezon City, right? How long have you been sa Iloilo, Jen? Tagal na
pagkabata po.
Yeah. And then, you're moving na dito sa bandang area na to. Yan. Jen, actually, I was looking at Jen, okay? You look young, kasi small face, no? Pero sa center ng mukha niya is her concern. Main concern, kasi we are Asians, we are Filipinos, yung dito sa bridge. So, you're looking at the dorsum of the nose here. Ito ang concern ni Jen right now. So, in the center kasi, meron tayong tinatawag na dent here, okay, on the renion part. So if you're gonna look at the anatomy of her nose, she really has an inadequate dorsum height, okay? So if you follow the proportions, the ratios, the angles, the frontonasal angle, labionasal angle, so somehow, we want to also achieve those kinds of measurements. No, Jen? Right. Kasi, actually, Jen, mukha ka ng bata eh. Yeah. No? Cute ang face, right? So, we just want to enhance. And Jen kasi is more of the non-surgical. Ayaw mo rin nung may hiwa. Ayaw mo ng opera. So, she wants to also try the non-surgical way with a natural result. Na somehow, they will still recognize Jen if she goes back to Iloilo. Right? Kung uuwi siya sa Iloilo, baka mamaya hindi ka na makilala. Right? She wants a procedure na natural, at the same time, she's still recognized. Okay? So, we'll show the treatment when CSA Medical Aesthetics returns. And we're back, everyone. We are doing the assessment for Jennifer, okay? So, I was looking at the anatomy of her nose. So, if you check on the radix region, okay? So, we really have this flat dorsum here, okay? And I'm palpating for the bony area here, okay? And then, as I go down in the distal area here, okay? So, the cartilage region is here, nasal cartilage is here. So, we have a round-shaped tip and a wide alar here, okay? So on the dorsum, we need to improve the height and create that dorsal aesthetic line here. And when it comes to the tip, we want to make it less round. And we also want to improve the columella here, do some tip columella projection, and somehow narrow the alar width area here. So if you check on the intercanthal width like this, so we really have to reduce this. So for our non-surgical treatment, okay, as with any other procedures, we cleanse the area, then put some numbing cream or inject a numbing lidocaine at the entry point. That's our start, okay? So you're ready, Jennifer? Yeah. Si Jennifer kasi, we're in our golden age, okay? And somehow we still want to improve our looks, right? The non-surgical nose enhancement right now, Jen, is part of the anti-aging treatment already, okay? So even the nose, your nose also will age. So the nose will also experience a so-called atrophy of the tissues or like a droopiness or sagginess of some of the tissues, okay? So we'll be pinching this, and this is the entry point, okay? And then Jennifer has a high tolerance. So there you go, that's the lidocaine. Now we make an entry point here. I'm using a gauge 19 puncture needle, and I'll be still using a hyaluronic substance here, so we need volume. So whenever we have like a dorsum that is like this, we still wanna inject a hyaluronic substance to give volume to the nasal region, okay? So I'm pushing a hyaluronic substance here. You need something that has high G prime, and I'm using a cannula, and I am gliding it in between the layer 4 and layer 5 of the nose anatomical tissue layer, okay? So we have like a short nose also. So it's typical amongst Filipinos having a short nose. Okay, so we're pushing a little bit of this material, just a little of my hyaluronic. And this one already has a lidocaine with it, so it helps in numbing the area also. And then we'll be injecting also hyaluronic into the space in the tip columella area. Okay, there's this intercrural space here, and I want to reach the so-called anterior nasal spine. So for those who are doing tip columella projection, especially for Filipinos, we want to fill in the anterior nasal spine plus the space inside the columella. Don't overfill anymore the tip defining point, because usually Filipinos, we have round tip and we have like thick tissues in our tip of the nose. So for my Filipino clients, I fill in the anterior nasal spine and the columella space there. And there are times I only use minimal amount of my filler. We also don't want to overfill, so we just want to keep it in the right dimension, right size, right measurement. So I'm expecting here some adhesions, because I noticed that kind of like she has a scar on the dorsum of the nose. So something like the skin is tethered into the deeper tissue structure. So I'm expecting some resistance there. I'm using now a PDO thread. Okay, this one is the Stellar PDO with a gauge 19 50mm length of the cannula. And usually the thread that we can use for a short type of nose, we can use like a 50mm, 60mm type of length. So you have to make sure that you're inserting a right length of your PDO thread material in your patient's type of nose. So if they have this short nose, you can also use those short type of your nose PDO threads. Okay. So I'm experiencing some like resistance in this area here, which is actually expected for her. Okay. And then I'll be proceeding to the nasal tip projection. I'm creating again a second entry point because she has a short columella. For some cases, if they have long columella, it's okay to use the same entry point. But for those with shorter columella, I make a second entry point. So for now, I'll be also narrowing the sides. I'll be doing the so-called alar bunching. So this is just a lidocaine for you, Jen, okay? I know the lidocaine has like a sting sensation. And I noticed Jen's skin, she tends to have redness. Right, Jen? Bilis ka mamula. Your skin tends to have redness. Erythema, that's what we call it. I'm now injecting lidocaine into the alar region. You need to numb this area for the alar bunching. I'll be using spiral cog threads for my alar bunching. So we want to create a width, an intercanthal width that is somehow within the ideal width of the nose. I'll add lidocaine in the base of the columella region, okay? So whenever you pass the cog thread there, we can still pass through and just have Jen like not feel the passing of those cog threads. Okay, so I'll make an entry point here, and actually I need to make a second entry point at the opposite alar. Okay, and I'm using here a spiral cog here. So anatomically speaking, you have to be aware of the blood vessels lateral to the entry point. You have to know where the facial artery branches are. So those are the ones that you have to avoid. Nowadays, whenever we're doing injections, because we already have this ultrasound technology that we use to detect where the blood vessels are. In our center, we already have our so-called ultrasound guided face injections. We use the Sonofinder from Endfinders. So there are cases that I use that device to locate for the blood vessels of the face and avoid them. I'm already on my second cog. Okay, I'm already crossing midline and then near the exit point. So this is my exit point. So you just have to make sure that you're in the right layer, and then you see your exit point there. Okay, so I'm already out. Okay, there you go. So pulling out, and then this is bunching. So when we bunch, we want to make the tissues go midline. Okay, so we'll be doing the so-called knot. There you go. So I'll make a second one. Then this knot here, we should embed it within the tissue inside, okay? We're almost done, Jen. Okay, Jen's still okay. Yeah, she's okay. So actually, there are cases that I combine Allertox and mesotherapy. With Allertox, I target the flaring muscles of the Aller region, the Aller muscle. And then I also inject mesotherapy for the fats to reduce the fatty tissues in our nose. We have the superficial and deep fats. So ideally, you have to embed the knot inside, okay? So we're done with the nose procedure for Jen. We'll show the result when CSA Medical Aesthetics return. Back, so we'll now show the result to Jennifer. Okay, Jen, here's our mirror, okay? So in summary, we have done the so-called or a combination of the bridge lift, the tip columella projection, plus the Aller bunching. So we did a combination of filler and those PDO threads. So for the bridge, we had the hyaluronic dermal filler. We also have those PDO threads. Now, the length of the threads that I used, I varied them. Like, I even used like a 40 millimeter or 50 millimeter shorter as compared to the others. Now, for the tip columella projection, I still injected filler into the anterior nasal spine, the columella space or the intercrural space, plus also used those short PDO threads in that space. And then we did the Aller bunching using the spiral called threads. And we inserted from this side to the opposite side. And then we also did like a knot to kind of stabilize the ones on the entry and exit points, okay? So that they will stay able to grasp the soft tissue layers to bunch towards the center of the nose. So, Miss Jennifer, speechless na po siya. Okay, I'm looking at her right now and I'm saying she looks like a mestiza right now. She's from Iloilo and it seems like she has some, you know, in her skin, I can see some like features of Spanish skin or like Caucasian skin. Okay ka lang, Jen?
Okay,
Yeah.
ganda.
Ganda. Kanina kasi your concern was you have this dent, yung parang may lubog. That was her concern and she asked me, Doc, nawala na ba yun? So, napansin mo here, nawala na. Umangat na siya. And if you look at the profile view niya, tingnan niyo po side view niya. So, it's a better frontonasal angle plus the nasolabial angle was improved, plus also the Aller width. Okay, we were able to narrow the Aller width. Later on, we'll still do the so-called Allertox so that the muscles will not be flaring or be dilating. Okay, Jen, thank you so much. I'm so happy for you. Even your eyes, the eyes look a lot younger too, right? Happy? Yeah, she's so speechless. Actually, every after procedure ng nose, all my clients are like, they just keep on holding the mirror and just love looking at their new nose right now. Achieve, dream come true. Yeah. Jen, thank you so much, okay,
Thank you,
for
Ma'am.
coming over and joining us today, and also like sharing with our audience this kind of before and after treatment na possible din pala in a non-surgical way and still natural. And I think they will still recognize Jennifer. Okay? Thank you, Jen. God bless. Okay?
Thank you po. Salamat.
Yeah. So later on, we'll still give you home instructions, okay, after this procedure, and we will prescribe some home medications, okay? For those who have any questions, you may email us at csaskinclinic@yahoo.com. We have our FB page, CSA Medical Aesthetics, also Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact numbers 0933-860-9193 or 0917-504-4268. And our other videos, please do watch them. Just look at our YouTube channel, Contessa Salvador, and please do subscribe. Okay? God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.